Good evening. This is David Corridon, also known as Corridon MD, internal medicine board certified physician in Florida, going over the Florida COVID-19 situation as of March 21st. On review, we are at 763 total cases, bringing up the number of total Florida residents with the COVID-19 infection confirmed to 706. When we break it down, Broward County is currently in second place to none other than Miami-Dade at 169 versus 164. Palm Beach at 56 cases, and Hillsborough County currently is rising rapidly up to 47 cases confirmed. As of new cases per day, we see that in blue is March 21st, and we have had 200 new cases as of March 21st on one day. This is something be of concern for all of us. In Broward County, in one day, we had 36 new confirmed cases, and in Miami, 46. This in lieu of the ramp up of testing that is going on thanks to Governor Ron DeSantis and the many partnerships that are being made in the community with the regional hospitals like Memorial, Broward Health, Cleveland Clinic, and so on and so forth, ramping up mobile testing centers so that we can find the cases where they are. Something to be very, very aware of is the curve or the rate of infection. As you can see here, I've been tracking the doubling rate. In red is the 48-hour mark. So we start at the top left on March 14th. The case rate after 24 hours, so from March 13th to the 14th, was 1.51 times higher. By 48 hours, we had 2.2 times more cases than we did on March 14th. In other words, by March 16th, we had doubled our rate. And that continued, as you can see, from on the 15th, the 48-hour mark also had doubled. On the 16th, the 48-hour mark still 2.05 times from March 16th. On the 17th, still double. And as of the 18th, we could see a decrease, that there has been 1.7 times the doubling rate. In other words, we are starting to see a decrease in the number of cases that are rising. Hopefully, this also signifies that there's a decrease in the spread, though these numbers do not reflect an exact situation, since in Florida, as in all around the country and the world, the number of actual cases is much higher than the number of confirmed cases, and it is in due time that we will find these cases, hopefully. So as of today, March 21st, you can see compared to March 20th at the 24-hour mark, we have increased by 1.35 times from yesterday, which is about a 35% increase, in other words. And these numbers seem to be lower than previous dates. Hopefully, with the quarantine measures, with the closures of schools, with the closures of shopping centers and restaurants and the like, we will continue to see this continue to drop. Another perspective here we can see in Broward County, in the county rates. I want to draw your attention to the top right little box. It shows the proportion of male to female. We are at about 59% male infections versus female 41%. This does not mean necessarily that the virus prefers males over females. It may raise questions as to the symptoms that are more pronounced in males, or males have more comorbid illnesses or in other conditions such as high blood pressure, kidney disease, and the like, which may make them more risk for developing symptoms and therefore obtaining testing. So these numbers do not necessarily signify any one thing, but it is a trend that we are seeing. In the bottom right corner, we see by age group how the COVID infections are breaking down. Of note, as you can see, the young persons are getting infection, and this is the group of highest concern in my opinion, not because of the high risk nature of these group of 20 to 29 year olds and 30 to 39 year olds, which comprise at this time about 26%. And if you include the 40 to 49 year olds, that goes up to 40% of the infections are in patients younger than 50 years old. This is a great concern because these are also the persons that are less likely to perform social distancing measures and quarantining voluntarily, which increases the risk of propagating the condition to those that are higher risk, such as those over 60 years old and the like. So please encourage your family that are younger than 50 to quarantine, to socially isolate, to be mindful of their potential to spread this infection. Moving on, another way of looking at this is also at the total deaths. This is a very sad time, as we can see on a day-to-day basis here. Our death rate has been climbing. As of March 21st, we're at 12 total deaths, one more than we did yesterday. And another important numbers that I'm tallying on the right side, mortality rate. This is another word is a case fatality rate. To put this in perspective, I'm taking the total number of cases identified on that given day and using the deaths that have occurred by that day and obtaining what is the case fatality rate or mortality rate. This does not mean that, for example, on March 15th, 3.7% of persons that have the infection in general will die. No, because of the very important point that the actual number of cases is much higher than the identified number of cases due to lack of testing, due to lack of symptoms that are not prompting people to get testing. And so these numbers are more indicative of what the symptomatic case fatality rate is. In other words, a patient that has the symptoms of an infection goes and gets testing, and then of those that have gotten testing, how likely are they to have died by this date? And as you can see, I've been tallying it on a day-by-day basis, and it seems to be decreasing. But this is only decreasing in the setting of a ramp up of testing that has been quite dramatic, thanks to many things that are going on at the governmental level, at acquiring testing kits, acquiring swabs, making the hospitals and the organizations in the private sector part of the task force. If we look at the average in the last 7 days, the death rate is at about a 2.6%, which is within what is reported currently at the international level between 2 to 3% case fatality rate. So we are keeping in par with that. Looking a little bit further down here, very important topic is what are the testing rates? Testing rates are extremely important for the main reason that if we identify cases, then we can make interventions that are very, very limited to the cases instead of blanketing approach of locking down cities and putting curfews and things like that. Unfortunately, the best method at this time is to quarantine, is to lock down, is to close schools, and this will definitely, and I think we're already seeing an impact of that, will decrease the rapid increase in cases. There are many theories, quote unquote, out there that are saying that this is not a matter of if you're going to get the infection, but a matter of when, and trying to decrease the number of cases that happen at once is the main effort that is going on. So the testing rates, as you can see in the first is the dates by date, how many we were testing, total tested, total positive, etc. And In green on the right, resulted positive LR. LR stands for likelihood ratio. So this number here, this percentage, is telling us what is the likelihood that somebody that got a test, that went to a testing center and received the test, what was the likelihood that that person actually had the infection? So as you can see, the numbers have been fluctuating between 13% up to 20%, and as of the 20th, have decreased dramatically. What I want to point to is that on the 20th, the number of total tested went up from 3,254 to 7,367. In other words, we had been testing about 400 to 500 persons per day. And because of the efforts of our government, our number of tested individuals had increased on one day by over 4,000, which is dramatic. And that is the reason why the resulted positive likelihood ratio, the likelihood that a person tested on that given day, decreased by more than 50%. That is the reason why. As you can see, the new tests given column, 4,113 were tested on March 20th. And on today, March 21st, what is reported is about 1,971 patients tested, and we're about 9% positive likelihood ratio. Another very good thing to know, it is what is the per capita testing in tests per million. In other words, this number is a very good reference to know if our state of Florida is keeping up with what is going on nationally, with what other states are doing, and internationally. Some of the Asian countries are testing thousands of patients per million. And as you can see here, I have broke it down on a per day tests per million. So as of today, March 21st, on the bottom, 91.67 persons per million inhabitants of Florida were tested. The cumulative tests per million up to this date, over the last 6 days that I have to calculate, we're at about 434, and this number is probably under what is the current number, but this is a rough estimate, and this makes Florida be at a pretty good level as far as our testing that we are currently performing. So we are doing pretty good, and we're going to continue to ramp up testing. There are a lot of places that are being currently developed so that we can get testing to all those people that need it. So here are how Florida is standing in front of the nation. And this is a very important slide also to put in perspective. Look what is going on in New York. From the March 18th to the 19th, it more than doubled the cases. That is, in 24 hours, more than double the number of cases. Part of it is due to increased testing, but part of it is due to a very widespread community spread, which means that persons are giving it to others, that these quarantining measures have not occurred or not been effective. As of today in New York, they were at 11,710. So that's in 48 hours. Now they have doubled again in 48 hours. So imagine in another 48 hours, they could be at over 25,000 cases. And that just puts a great stress, a strain on the healthcare system and the capacity that they have. Here in Florida, highlighted in yellow, you can see that our cases today are 763 compared to yesterday was 563. Yesterday I had a speaking event, therefore I had very little time to update my tables, and that's the reason why March 20th is in a lot of blanks there for the other states. What else is important in this slide is to look at these New Jersey. New Jersey in 48 hours went from 267 to 742, and then in another 48 hours, 1,327. They're at about a 48-hour doubling rate, which is concerning. Pennsylvania, 206 up to 396 in 48 hours. Michigan, my buddy is in Michigan, and he tells me his hospital is full. Their ICU beds are full. They have 20 patients alone with coronavirus infection on mechanical ventilation and over 60 patients in their hospital. Michigan, in certain areas, is in a state of emergency, just like we're calling it in Florida. They went from 334 on March 19th to 788 cases. So we need to do something. We need to do something now. This is the curve that we're talking about when we say flatten the curve. When you stay home, when you don't go where you don't need to go, when you don't visit your mom or your dad because they're sick or you're sick and you don't want to contact them and get them sick, or you stop hanging out with your friends because you know that you might not have the symptoms but you may be carrying it, and if you hang out with them they may get it and then give it to their family. And when you do these things, when you wash your hands, when you avoid touching your face, when you are hyper vigilant about you and your hands and what you're doing with them, you are helping flatten the curve of COVID-19 infections in Florida. So we really depend on you. I'm a doctor, but I cannot make this happen. The government cannot make this happen. The health department cannot make this happen. Only with your support, with your family's understanding, with the things and the measures that are being put in place. And I know this is a great stress, and we really need to listen to our authorities, listen to what they're telling us to do so that we can help flatten this curve. We do not want what is happening in Michigan to happen in Florida. In Florida, the governor was saying we have about 1,700 critical care beds available. That is what is available of about 5,600 total critical care beds in Florida. We need these beds open. We cannot fill them all up at once, or we will have a catastrophe. This is something that you and I have to be aware of. We need to listen. I know it's a lot of issues going on. People are losing their jobs. People have food insecurity. People have to go out, or they lived in crowded places, in crowded spaces. I understand this is a very tough time, but please heed the instructions that are being placed for all of us, because you can avoid someone's mom or dad, someone's grandfather, grandmother from dying not because of the coronavirus alone, but because of lack of supplies, because of lack of medication, because of lack of supportive equipment, such as the ventilators that keep them alive, or machines that can do extracorporeal membrane oxygenation. These things are limited in capacity, and we need to make sure that we have them when you need them. So stay home. Stay safe, quarantine if you don't feel good, wash your hands, avoid touching your face. If you feel sick, call the COVID-19 Florida hotline, and they will tell you what to do. Call before you go get any help.